For this group presentation, our group created a clinical desktop guide on trauma-informed practice, which is available for you to print and follow along with during this presentation. Our topic was trauma-informed practice, and specifically that will cover what is trauma-informed practice, the effects of trauma, benefits of trauma-informed practice, the 7 domains for trauma-informed practice, personal qualities of a trauma-informed practitioner, principles for trauma-informed practice, the implementation of trauma-informed practice, how this applies to different populations, and how to manage vicarious trauma to the practitioner. So what is trauma-informed practice? This is an approach to practice that's based on the assumption that all clients have experienced trauma and that this trauma manifests as the mental health or substance use concerns that present. The approach seeks to provide safety and to minimize the risk of re-traumatization. It sees the problem behaviors as a result of trauma. To begin, we need to ask ourselves, what is trauma? How do we conceptualize this? In the Trauma-Informed Practitioner's Guide, published by British Columbia, it defines trauma as the experiences that overwhelm an individual's capacity to cope. Trauma early in life, including child abuse, neglect, witnessing violence, and disrupted attachment, as well as later traumatic experiences such as violence, accidents, natural disaster, sudden unexpected loss, and other life events that are out of one's control can be devastating. The different types of trauma can be categorized as single incident trauma, which will be one traumatic event, complex or repetitive trauma, such as ongoing abuse, developmental trauma, which results from exposure to early, ongoing, or repetitive trauma in infants, children, or youth. This is often neglect, abandonment, domestic violence. Then there's intergenerational trauma, which describes the psychological or emotional effects that can be experienced by people who live with trauma survivors. And finally, historical trauma, which is the cumulative emotional and psychological wounding over the lifespan and across generations emanating from massive group trauma. The effects of trauma can be psychological, which some examples of this would be anxiety, shock, depression, disconnection, irritability, flashbacks, memory loss. There's also physical or somatic effects, which can include chronic pain, headaches, sexual dysfunction, heart palpitations, digestive problems, muscle strain. Then there's behavioral effects such as suicidal behavior, substance use, alcohol use, risk-taking behavior, tobacco use, among others. Then there's social effects such as withdrawing from social circles, and finally emotional effects. So that would be fear, shame, guilt, and other negative emotions. Also, trauma, especially during development, can have cognitive effects. Next, the benefits of trauma-informed practice for the client include a sense of safety, calm and nurturing relationship, which provides a source of stability and reliability. The therapeutic relationship in trauma-informed practice also provides an external source of emotional regulation and can decrease the client's experience of a negative event or crisis. This type of practice is based on empowerment and self-efficacy of the client, and it is strength-centered. Some of the benefits of trauma-informed practice for the service provider are the provision of a clear framework in which to provide services, the availability of trauma-informed practice education and ongoing training, It lends itself to collaborative interprofessional practice and therefore effectively allocates resources. It also provides support for vicarious trauma that may be experienced by the service provider. Some of the challenges of trauma-informed practice include the potentially limited client demographic that's served, especially if the trauma is not obvious. The program availability and funding, as this is a newer concept. And the availability of a comprehensive and standardized model to implement. The 7 domains of trauma-informed practice that is provided in the British Columbia Guide include early screening and comprehensive assessment of trauma. So does your agency have a respectful screening and assessment process that is culturally sensitive and revised as needed? Second one is consumer-driven care and services. Is your agency grassroots? Do your clients participate in the development of services and programs or decision-making? The third domain is trauma-informed, educated, and responsive workforce. So does your agency support continued education and skill building for trauma-informed practice for employees? The fourth is provision of trauma-informed, evidence-based, and emerging best practices. So how does your agency support research-informed treatment and services associated with trauma? Is your agent current on best practices? And the fifth domain is to create a safe and secure environment. Does your agency continuously evaluate the workforce and create a safe, trusting environment, including in their policies and procedures? The sixth domain is to engage in community outreach and partnership building. Does your agency engage other service providers and systems to enhance a systemic shift to trauma-informed awareness and practice? And finally, domain 7, ongoing performance improvement. Does your agency measure performance on each of the trauma-informed core domains by tracking and analyzing the data to inform leadership and sustainable change? Next, we'll move on to the qualities of trauma-informed practitioner. A competent trauma-informed practitioner will have a resilient sense of self, a capacity to be the secure base for another, relational capacity, the ability to manage behavior, handle rejection, and a willingness to explore your own attachment history. He or she will be engaged in reflective practice. Some of the principles for trauma-informed practice include validation, integrated recovery, safety, respect, and acceptance, which creates an environment that offers physical and emotional safety to the client, trustworthiness and transparency, a strength-based approach that recognizes client strengths and validates resilience, collaboration between staff and between the service provider and the client, which emphasizes a sharing of power in decision-making, again, empowering the client. And that all comes back to empowerment, using a helping relationship to facilitate the client's active role in recovery, promoting choice and control. And all of this is founded on social location, so moving past stereotypes and biases and offering access to service relative to the client's social location. It's a subjective response that is appropriate and sensitive to the client's context. So how do we implement trauma-informed practice? Trauma-informed practice should be implemented on all levels of service delivery. So here's a little diagram which we'll move through step by step that kind of conceptualizes the implementation of this approach. So first, preparing for trauma-informed practice. It requires self-awareness. You need to reflect on your beliefs about recovery, be aware of your own triggers and your own vulnerabilities. An awareness of vicarious trauma, a prevention plan, an ability to recognize symptoms, and a plan for management of vicarious trauma. Trauma awareness and understanding of what is trauma, what are the symptoms, and what are the effects. And then one needs to consider the power of language, to understand the implications of language, to move in a positive direction, and to use language to empower a client. The next step is engaging. So we use an acronym, OARS, which stands for Open-Ended Questions, Affirmation, Reflective Listening, and Summaries, which are all effective ways of engaging with the client. One can begin with an opening statement that expresses collaboration, safety, and supporting autonomy as a starting point for this approach. Then there's agenda setting, so the helper can collaboratively with the client list topics for conversation, find a focus, and discover what is important to the individual in order to provide focus to the conversation. The adaptation refers to adapting the conversation to the age, diversity, cognitive abilities, developmental stages, and other factors specific to that client. Next, we move on to asking about trauma. So when we're asking about trauma, it's important to provide rationale and to normalize the process, to make choice explicit, thereby empowering the client, and to elicit strengths within the client. One should also avoid several things, such as asking for details, confrontation, minimizing or ignoring the experience, focusing on the negative, making assumptions, and finally making promises that you cannot keep. Next is making the links with trauma. So pacing and timing, we need to establish safety and rapport with the client first and then move on to more sensitive subjects. We need to assess the readiness of the individual, listen and normalize the experience, understand reactions and link those reactions to responses. And then we want to communicate several key messages. So there's the trauma awareness, making sure that the client is aware of the trauma and sees the link between the trauma and the problem behavior. Destigmatize and again normalize the response. Emphasize resiliency and hope, and emphasize that the trauma is not their fault. And then move on to highlighting support systems that are available.
So skill building and empowerment. Teach grounding and self-care strategies that help create safety and strengthen resilience. In skill building and empowerment, you can apply a stepped approach when a client is experiencing an in-the-moment trauma response. First, you will allow the client to experience bodily responses and the feelings until they are over. Be aware of your own internal reactions. Provide verbal support and grounding. Stay present. Check in with the client. Find out what they need to be safe and if you should continue.
Next, we'll discuss trauma-informed practice for different populations. So for effective trauma-informed practice, the care provider must consider the trauma within the context of the individual and to be aware of his or her own social location, biases, and values, as these will undoubtedly influence his or her perspective. An effective way of doing this would be to collaborate with the client to create contextually appropriate and culturally safe treatment plans. So trauma-informed practice for intergenerational and historical trauma. It's really important to make the link between the trauma and the presenting mental health and or substance use concern, as this link might not be obvious to the client. To do so, one can explore the client's family, community, and cultural history. And it's important to consider the origin of best practice frameworks and to potentially consider alternative treatments.
So it's important to be aware of vicarious trauma. Vicarious trauma is the result of witnessing and listening to traumatic experiences of clients. This indirect trauma can result in feelings and symptoms similar to trauma survivors, and you can see those symptoms listed in the booklet in front of you. Managing vicarious trauma, first for individuals, awareness, understand personal needs, limits, emotions, and resources. Be mindful of the impact of your work on your life and perspectives. Balance, create and maintain healthy boundaries between work, play, and rest. Set realistic goals and practice effective time management, among other things. Connection, develop support systems and avoid professional isolation. Seek out feedback and opportunities for debriefing, and access training to develop new skills and build competence. So for agencies, it's important for them to acknowledge vicarious trauma as a reality and occupational hazard, and create a safe environment where staff feel comfortable discussing vicarious trauma. Provide acute care and preventative training to staff. Offer information and strategies that address vicarious trauma. Encourage ongoing open discussion of vicarious trauma among staff and administration. Reduce or balance the staff caseload, and ensure high-quality mental health coverage and employee assistance program. And that is our presentation.